Hello, my name is Xavier Caro. I'm a rheumatologist and clinical immunologist here in Northridge, California. I'm also the director of the Southern California Fibromyalgia Research and Treatment Center. What we're doing here is putting together a series of tapes, brief lectures if you like, mainly aimed at my own patients and trying to explain to them what they're going to go through. If you happen to be a visitor, welcome. You may want to consider some of the things that we say as well. First, let's begin with a brief overview of fibromyalgia, what it is and what it isn't, if you like, and what I am going to say and what I'm not going to say. What I'm not going to say, I'm not going to spend a lot of time here talking about the symptoms of fibromyalgia because, honestly, I think you as patients or you as visitors probably know all of that. There are hundreds, perhaps thousands of videos on this. You have your own experience. Perhaps you have a loved one, a friend, someone who's close to you and you care about who has fibromyalgia. You know what they're going through. Instead, let's talk more about what fibromyalgia is and how we approach it here at the center. First, what is fibromyalgia? It's a systemic disorder. It's made up of three major components. That is the pain, which I suspect most of you are aware of. It's certainly the most common thing we hear about here at the center. Second, fatigue, chronic fatigue, profound tiredness. That is clearly the second most important thing that we hear about here at the center, although in some patients that may be a major complaint. And there are some patients who do not even know they have fibromyalgia but see themselves as having chronic fatigue. Third would be cognitive dysfunction, inability to maintain attention, inability to use short-term memory the way you would like. These three components make up a lot of what we hear from our patients. Once again, that's musculoskeletal pain, generalized, widespread, and worse in specific areas of the body. Second, chronic fatigue. I can sleep 8 hours, I can sleep 10 hours, Dr. Caro, and I wake up tired. Third, fibromyalgia fog, cognitive dysfunction, difficulty with memory, typically short-term memory, and difficulty with attention. Let's talk about why we have these and how they come about. First, most patients are surprised when we tell them that they have probably had a tendency to fibromyalgia that's been going on their entire lives. This will become more clear as we discuss what is happening in the fibromyalgia patient. It manifests itself, however, in different ways at different points in their lives. Now, I can tell you that we frequently have to test the patient to the point where we can then prove to them that they've had this their entire lives, show them what is the problem. And by the way, sometimes we have to show insurance companies, spouses, employers, and so on. But also, we have to convince the patient. Why? Because the patients have been brainwashed into thinking that they have nothing wrong with themselves other than some problem in their brain, which the typical practitioner may explain to them has to do with an abnormal chemistry in the brain or perhaps an abnormal structure in the brain, which requires brain-active medications. These may be in the anti-seizure field, or they may come out of the antidepressive field. Clearly, this is not the way we go about the evaluation of patients here at this center. Instead, I'd like in our next video to give you an idea of how we approach the patient who has this disorder, and more importantly, why we approach them the way we do. Thank you.